वंदे फैजान, दिस इज 89.1 रेडियो 4। आज हम बात करने वाले हैं डॉक्टर नंदिनी संकरानारायणन से, हु इज अ हाईली एक्सपीरियंस्ड स्पेशलिस्ट ऑफ्थेल्मोलॉजिस्ट, मेडकेयर आई सेंटर, शेख जायद रोड से। एंड ऑफ कोर्स वी गोना टॉक अबाउट ग्लोकोमा, क्यों होता है, कैसे होता है, रिस्क फैक्टर्स क्या होते हैं, अवॉइड किया जा सकता है या नहीं किया जा सकता है, व्हाट आर द ट्रीटमेंट ऑप्शंस फॉर दैट। एंड फॉर दैट डॉक्टर नंदिनी इज राइट हियर विद अस। वेलकम टू द शो डॉक्टर।
Thank you so much for calling me on this occasion of World Glaucoma Week.
डॉक्टर, फर्स्ट एंड फॉरमोस्ट टेल मी व्हाट एग्जैक्टली इज ग्लोकोमा एंड ये किस तरह से अफेक्ट करता है विजन को?
Glaucoma is one of the diseases that affects the optic nerve in the eye. So think of eye like a camera. Whatever information goes into the eye is transmitted through a cable to the brain. So this cable is your optic nerve, right? So this is the area where glaucoma affects the eye. And inside the eye there's a clear fluid which is produced to nourish the eye, and this fluid drains out through a natural drainage system. But in glaucoma, this fluid does not drain properly, and this causes pressure to build up and results in what is called as glaucoma. So, over a period of time, as the pressure rises, this optic nerve gradually gets damaged and results in a typical glaucomatous appearance, wherein the side vision is affected, but the central vision is always intact.
What are the symptoms of glaucoma? How would one know if they are getting glaucoma?
Glaucoma is one of the diseases that has no symptoms in the early stages, which is why it is all the more important to pick it up. But as glaucoma progresses and becomes advanced, that's when something called as tunnel vision is something which the patient perceives. So in the very early stages, there could be some eye discomfort or a dull headache. Sometimes the patient may perceive some colored halos around the light, especially in the night time. There could be a difficulty seeing in dim lighting, and there could be some blurry or patchy blind spots in the field of vision.
Okay, Dr. Nandini, what are the risk factors for developing glaucoma?
So there are various risk factors. Most important one is increased eye pressure. Second is increasing age, especially after the age of 40, and more so after the age of 60 years. Then family history of glaucoma. Then certain ethnic backgrounds like Africans and Asians, they have a higher risk of developing glaucoma. Inappropriate use of steroid medications in any form for a very long duration, or a history of injury to the eye in the past. It could be years before. Then people who have very high minus number or a high myope or a very high plus number, also known as hypermetropia.
Tell me this, Dr. Nandini, is it treatable, or are there any treatment options available for this?
So once the diagnosis of glaucoma is established, treatment is in the form of laser treatment, or in the form of topical eye drop, or in the form of surgical intervention, which could be a minimally invasive glaucoma surgery, or also an invasive surgery like what is known as a glaucoma filtering surgery or a tube shunt surgery.
My last question to you, Dr. Nandini, is glaucoma preventable?
Glaucoma cannot be prevented as such, but once it is identified, we can definitely ensure that a further affection of the vision does not happen.
Thank you so much, Dr. Nandini, for being here with us. Ladies and gentlemen, Dr. Nandini Sankaranarayanan is a highly experienced specialist ophthalmologist, Medcare Eye Center, Sheikh Zaid Road. Par if you have anything, if you want to, test your eyes, if you have a doubt about glaucoma, now you know about it, just go for a checkup. All right. Thank you so much, Dr. Nandini, once again for talking to us.
Thank you, Faizan.